And we are live. It's Dr. J here in the house with Evan Brand. Evan, how are we doing today, my friend?
I'm pretty good except for my neck. I've got one of those crick in my necks. It's like I slept wrong on the pillow. And so I thought, okay, we got to cover on a podcast. What can you do naturally besides go run and eat ibuprofen like candy when you have pain and inflammation? So I think this will be very helpful for many people.
I think it will too. So we're going to get to the root cause of joint pain as well as natural treatment issues. So that like natural treatment things, supplements, strategies, lifestyle approaches to get to the root cause. So first thing is, what's the root cause of your neck pain? I know we chatted. Pretty simple. You slept on your neck wrong, right? So was there a pillow issue? Do you not have a good pillow that has good support? Was it a one-off where you just slept bad? What happened?
I think it was a one-off. I probably slept crooked. My daughter came running in the middle of the night to jump in my bed and put her head on my pillow. And I was like, Summer, get off my pillow, go back to your bed. She didn't want to do it. So I probably made I was trying to accommodate her, and I probably did some weird position I don't normally do on my pillow. So then I woke up and then I'm like a 90-year-old, man who can't turn his neck.
Got it. So what happened was you tweaked kind of your normal routine and how you slept on the pillow. So
Yeah.
probably either she slept on it or contorted the kind of the support thing for you there. And that's what created a lot of the inflammation in the neck.
Yeah. So I'll blame it on my daughter.
Okay. All right. Well, in general, pillows I think are really important. Favorite pillow is going to be the Tempur-Pedic with the cervical curve is really good. And they have one, I think it's called the Rhapsody, and it's meant for if you're a back sleeper in the middle, it gives you that good cervical support, and then it steps up a little bit on the side. So if you want to sleep on your side and you roll to the outside of the pillow, it steps up a little bit. So then you have a little bit more support so your head's not crunched in like this. And
Here,
so I
here's the
like that
funny
pillow.
thing. So, when I put my daughter to sleep, I've offered her own pillow in her bed for the past 3 years, and she never wanted her head to be elevated until recently. Because I always thought, well, did our ancestors use pillows? Did they sleep on like I don't know, a big old pile of feathers or something? Like, did our ancestors sleep flat, or were they elevated? And it's interesting. As soon as she hit age 3, it was like the snap of a finger. All of a sudden, she wants her head elevated now. It's almost like she knows that you get better lymphatic drainage or something when your head's elevated, because previously she didn't care about it at all. She was fine to be flat.
Yeah, it's one of those things too. It's like you don't know how good you got it until you got it. You know what I mean? So when you come into this world, you're kind of a blank slate. Your expectations are pretty low, right? You just have breast milk. You're not used to eating a filet mignon or a nice ribeye. It's like, ooh, okay, this steak's pretty good. I kind of want to have this more regularly. It's kind of like that with every part of our lives, I think.
Yeah, I think that's what it is. So now she's spoiled. She's got the pillow and she enjoys it and loves it. But yeah, so I like the idea of the cervical thing. I did have one of those before. It was sort of I don't know if it was latex or a natural memory foam that had some of that cervical support, and I did sleep better. Now, from your perspective in the whole chiropractic field, would you advise people to not sleep on their belly? Because when you're on your belly, you're turning your head and your spinal cord's basically twisted all night.
Yeah, I'm not a fan of belly sleeping. Ideal sleeping is going to be straight on your back with a nice, good cervical support. That's going to be the most helpful because then that kind of maintains your cervical curve the whole time. If not, what happens when you go flat, that curve has to flatten out, and then that can create more disc pressure on the neck. So what happens when you go into flexion, you start to have the disc start pushes back towards the posterior nerve root. And so
Explain that to people briefly, because people, when they get lectured on posture, they think that you're supposed to just be straight up and down like a stick. And that's not actually how the cervical spine works, right?
yeah. So people that are listening, I'm going to do my best to describe it. If you're watching on YouTube, you'll see the YouTube link. I'll be giving you an analogy physically. So imagine my green celery juice here. Imagine that's like a big bar of soap, right? So if I'm holding that bar of soap like this and I gently cup my top hand on top of it and I have equal pressure like this and I'm pressing down, I'm going to have good support of that bar of soap. Pretend it's a bar of soap. Now, if I start to wedge it and push more here at the front of that bar of soap, that's going to start to squeeze it out to one side. So the bar of soap analogy, this is like the disc in between the two vertebrae. Okay. And so there's a natural cervical curve that's there. Our spine is not set up to be straight. So when you go lay flat, you're actually putting, even though your neck looks straight, you're actually starting to put your neck into flexion. You're starting to move your head forward a little bit, which then is the equivalent of taking this bar of soap here and we're starting to push it from the front. And that's squirting that disc out, and it can start to irritate the nerve roots. And then when those nerve roots get irritated, you get inflammation. That can shut down some of the deep cervical flexor stabilization, the scalenes, the SCM, the trapezius muscles. A lot of times the muscles in the back get tight. And then we don't have good stabilizers of that neck. And then we have a lot of pain and inflammation, and you can develop adhesions. So just having poor posture at night with not enough good support, that can create a lot of disc inflammation and a lot of muscle pain. When those muscles aren't working properly, it's like having your natural shock absorbers turned off. It's like going into your car and then all the suspension and the shocks are gone. So every little bump, you totally feel it.
Yeah. And when I was working out of a chiropractor's office, I was looking at x-rays all the time. And this is not a rare problem. I would say 95, 98% of people we looked at, they basically had lost that cervical shape. I mean, their neck was basically just straight. They had no curvature. So a lot of the work we were trying to do was, which it had limited success because the people were not doing diet changes and other things. They were just going into a traction device or something else to try to restore that curvature. And maybe it worked 50-50. I think it was not a root cause clinic that I was working out of. So I think we missed the boat on a lot of things.
100%. I'm going to share here the Tempur-Pedic website here so you guys can see it. Can you see it here on Evan?
Yep, we see it.
Yeah. So I like the Tempur-Pedic neck pillow. I have this one. This works excellent. And then the other pillow that I like, I think, is the Symphony right here. And this one's excellent because you have this little curve in the middle, which provides good neck support. And then when you turn sideways, it increases up just a little bit, which allows you to go on your neck. As soon as you go sideways, you need a little bit more because when your neck, if you rely on the same support while you're on your back, your head's going to dip in and then you're going to get shoulder pain. So you need your head to be still relatively neutral when you are sleeping. And so that's where I like the Symphony pillow because it provides you the versatility. You can still get that support with the neck pillow as well. You just have to make sure you get it just a little bit bigger, maybe an extra inch or so, or extra couple of centimeters to provide the support. So you want maybe an extra centimeter or two for your neck. That way, when you go to your side, it will compensate. So yeah, so the neck pillow does do side and back. And the other one is the Symphony. So those are my two favorite. I tried them. I tried a lot of them. I have the Cloud one. The Cloud one just doesn't provide the same level of support. So those are my two favorite. Hope that helps.
That's cool. Yeah. The one that I ended up getting was one that came with my bed frame. I ended up getting this like no VOC solid wood bed frame. It was a company that was called Savvy Rest. And they just they do like a shredded latex pillow. They do a wool latex pillow blend. They have an organic latex contour pillow. I guess that'd be kind of the crunchy version of the Tempur-Pedic, but they've done well for me. What about body pillows? You ever use those at all? Like to try to put something in between your knees?
You could do that. It really depends. That your next step, if you're having a little bit of shoulder pain, is you put a little pillow between your knees just to give you a little bit more support on your hips. That may matter more if you're a female, just because the hips are a little bit wider. And so then those knees go in a lot more, which can create a lot of hip shearing at the hip. So then maybe a pillow there would be good between the knees. Body pillows are great if you're pregnant. So my wife had a nice body pillow. So when she was pregnant, just to give you that little bit more support because you're having to lie a little bit more on the side, at least 15 degrees more. So having that little bit more support does help, and a body pillow can be helpful. And then also there's another pillow called the Medcline pillow, which is really good. So if you're a side sleeper and you have a lot of shoulder issues, the Medcline's nice because it allows your arm to go underneath the pillow, which is kind of cool. And we'll put some links to these pillows. I'll find some Amazon links we'll put below. That way you guys aren't having to hunt everything down. Make it a lot easier for you to find it all.
Cool. All right. Cool. So welcome to the Pillow podcast.
Yeah. And then again, like sleep is really important. So the pillow, and then obviously the mattress is really big. I'm a big fan of Tempur-Pedic mattress. There's also one that's pretty good that you've tried, the Zen Haven one, which is a really good hypoallergenic version that's more silicone-based.
I returned that one. You didn't like it? No,
okay,
I don't remember. I've
had some people that have liked it. I've had some patients that have liked it. It's very hypoallergenic. A lot of people that have had mold have gotten that one and done well with it. What one do you like now?
Yeah, the one I've settled on now is called Plush Beds is the company, and it's called a Botanical Bliss, and it is a organic cotton, like super thick organic cotton exterior, and then it is 3 layers of latex, which comes from a rubber tree. You've got like synthetic rubber, and then you've got latex tree rubber, and it's been pretty darn awesome. You can pick like your firmness, medium firm or more firm. You could pick the height of the layers. And I tell you, man, compared to the Samina bed, I spent $10,000 on that Samina
That's
bed
expensive.
and it was not worth it at all. And this other plush bed setup cost me about $2,000 and I sleep way better.
Yeah, and one of my Airbnb properties that I have, I put another bed in there that it's called a Simmons Beauty Rest. That one works phenomenal. That one is very comfortable. It's under $1,000. If you're worried about any off gassing, you can always get like a really nice airtight kind of mattress pad over it if you want to be on top of that. But I mean, the Simmons Beauty Rest, I mean, I've slept in it many times and it is very, very comfortable.
Yeah, I guess it depends on your budget, right? Like if you
Yeah.
want to go to the 2 grand, closer to maybe 3 grand, depending on the size of mattress, I'm telling you that Botanical Bliss is amazing. It's like Green Guard Gold certified, so there's no VOCs. It's organic wool and latex and cotton. I mean, it didn't smell at all except like latex, which latex doesn't mess anybody up. So I'm not affiliated with them. I would like to be affiliated with them, but I don't think they have an affiliate program. But anyway, it's a good mattress.
Yeah. And so with joint issues, it's really important. I cannot understate it, how important a good mattress and a good neck pillow is. So we talked about pillows, the more expensive side, Tempur-Pedic, the Plush one, right? 2,000 to 4,000 range. And then you have the cheaper one, which I like, the Simmons Beauty Rest. Very good night's sleep, under $1,000. So those are my two there. Let's go into more metabolic stuff. So with your issue on the neck, okay, now you have some joint pain. Well, number one, metabolically, your diet's great. You have a good omega-3 to omega-6 ratio, meaning the healthy anti-inflammatory omega-3 fats are relatively in check with the more pro-inflammatory omega-6 fats. You know, we want to be 1-to-1 or at least 4-to-1, meaning 4 times omega-6 to 1 time omega-3. That's going to be pretty good. That's really helpful. It's going to be a lot of the refined grains and processed vegetable oils that are going to be overly high in those omega-6s. And if you're doing lots of grain-fed meat, you'll maybe higher in the omega-6s as well. So good high-quality animal products will really balance that omega-3 to 6 out. Good high-quality fish oil, cod liver oil, and or animal products is going to really provide that good balance. And that kind of sets the overall milieu up from a fatty acid standpoint, and then just keeping inflammation down via food. And that could be just a general paleo template is an adequate first step, meaning keeping out the grains, maybe keeping out a lot of the conventional dairy, the high casein dairy, right? Maybe the exceptions are butter and ghee. Keeping out a lot of the refined sugar, right? Soft drinks, a lot of the processed sugar really is going to increase inflammation. So from a food standpoint, metabolic standpoint, those are kind of first line approach to keep that inflammation in your body down.
Yeah, and people listening may be like, well, that's the same thing you always say, paleo template. And the answer is, yeah, that's exactly right. But we have to make sure that we state that, because you could say that you go eat at Chipotle, and which I have done. And if I go to Chipotle, I'll see a lady behind me in line and she gets a burrito covered in so much queso, you can't even see the meat. It's literally just rice, queso, and then a little sprinkle of chicken. It's like,
Yeah.
that's not good. So now, does it taste good? Yeah, queso is delicious, but is it going to be good for your joint pain or inflammation? Definitely not.
Yeah, and there's going to be hundreds of new listeners coming in every week. So we kind of have to be a little bit redundant so people can kind of come in and grab that initial foundation wherever they're at in their journey. So there's going to be some redundancy there. Also, sometimes that's not enough. Some people who have autoimmunity, right? Sometimes these pains could be even of autoimmune origin, where there's some kind of a fibromyalgia or chronic fatigue thing. And a lot of the pain is indiscriminate. It's just randomly in different spots throughout the body, right? It's called central allodynia, where the pain is more neurological, not because you slept on your neck wrong, but just because the inflammation and the autoimmunity is so high, everything is inflamed without a known etiology. So there's more of a central allodynia, neurological, autoimmune-based pain, and sometimes an autoimmune template's even more important, where nightshades may be a problem. The alpha-solanines in the nut seeds, or the alpha solanines in the tomatoes, potatoes, eggplants, and peppers, which are the nightshades, or even the sensitivity to any plant foods, or even the butter or ghee or eggs or nuts, that may be enough to throw them over the top. So sometimes the diet has to be even more restrictive.
Yeah, and it's not necessarily forever. Some people may get down and they're like, okay, I'm eating, 10 foods. This is super boring, but sometimes that's required. And then of course, the whole time we're working backwards, you're working with us to get to the root causes. So if it's a mold issue or Lyme, Lyme is something, or mycoplasma, you could have all these different joint pains and you think it's something in your diet. But, my wife, it's been 5 years ago now, she had major joint pain and we couldn't figure it out. Her diet
Yeah,
was
she saw
perfect.
me, right? Remember you came and you're
Yep.
like, hey, she's got all these joint issues. I'm like, is there anything that you can? And then we ran a test for mycoplasma and it came back positive. And we started doing natural treatments for mycoplasma and the joint pain got so much better. I couldn't believe it.
Yeah, that MDL panel was a game changer. You're like, hey, I've got this panel here. It's a bunch of different Lyme and co-infections, but it also looks at some weird stuff that most people don't look at, like mycoplasma. I knew nothing about mycoplasma at the time. And, besides that, it was basically a bacteria that could cause different issues. I didn't know that it could literally cause you to have pain in every single joint at the same time. So we had done the fish oil. We did everything we could from the diet nutrition perspective, and she was still miserable. So it wasn't until we added in specific herbs, like we added in astragalus and cat's claw. I believe those were our two miracle workers. And within a week or two, she was basically cured. So
I think we added
yeah,
in cordyceps too, didn't we?
I don't remember,
Maybe.
but I
But
would
yeah, I
just say,
know we
yeah.
did those too.
But yeah, I would just say I'm eternally grateful for you educating me on that panel. And then of course, what would be the best solution to gain the upper hand on these things? Because your doctor down the road, they don't have a clue. They're not going to suggest mycoplasma. They're going to suggest a diagnosis of fibromyalgia, and then you're going to get put on a prescription, and everyone misses the root cause. I don't know why it's so revolutionary to say, find the root cause. It seems very basic to me.
Yeah, exactly. Now, the next thing that's going to be really important is the viscerosomatic reflex. This is really important. Medicine likes to use a lot of big words. When you break down the word, it becomes a lot easier. So visceral means organ. Somatic or somato means muscle. And then reflux means reflux. It's the connection back and forth, okay? And so when there's pain or inflammation in the surrounding organs, those organs have a 2-lane highway of nerve roots that go to them. The nerve roots that go to those organs are also on the same 2-lane highway that go back to the muscles. In other words, when there's inflammation in the organs, okay, it can create a sensory perception that reflexes back to the muscles. In other words, a woman on her period or leading up to her period, right, she may develop ovarian pain. Well, how's that pain going to represent? It could represent as lower back pain. Why? Because the ovaries are on that lower lumbar, upper cervical, upper sacral nerve root plexus. And so you could see a lot of back pain. Or someone that has gallbladder issues, you may see shoulder pain. Or someone that has a heart attack, you're going to see left jaw pain and or arm pain. Someone that has appendicitis, lower right hip pain, right? Or even people that have ulcerative colitis or a lot of joint issues, ulcerative colitis or a lot of gut issues, you may see a lot of chronic lower back pain. You even see it with kidney issues. What do you see with kidney pain or kidney infection, right? You see lower, T12, L1 back pain, mid to mid lower back pain because of kidney issues. So you can see these inflammation in these organ systems can actually create a symptom of pain in the muscle area. So you have to know that. It's really, really important. A good history will help, let's just say, elucidate more of this. So the more we have an acute response to what's happening, slept on your neck wrong, exercising harder, fell down at a sporting event, right? We can kind of put the pieces of the puzzle together of what the root cause was. The more chronic and insidious, then we always look at the diet, then we look at the organ muscle connection.
Yeah, well said. And I would throw adrenals in there too. I don't think you mentioned adrenals, but we've seen a lot of people.
Same thing as the kidneys. They sit right on top of the kidneys. But it's hard to differentiate adrenal and kidney because they're so bloody close. They're like right on top of each other. So yeah, we'd want to do an adrenal test to look at that. And I've seen that become an issue. Sorry for interrupting.
No, it's okay. So when you add in adaptogenic herbs, sometimes the pain disappears, which is interesting, right? Because you would think, okay, all this herb is doing is helping modulate the stress response, but all of a sudden the pain is gone. So yeah, I mean, I do adrenal support, I do kidney support, I do liver, I do gallbladder. I mean, I kind of support all the organs. And It's easy. It's easy to do, and it's, just good maintenance for your organs, right?
Yeah, adrenal issues are a double-edged sword, right? Because adrenals make a hormone called cortisol. Cortisol is a glucocorticosteroid. You break it down, gluco meaning blood sugar and energy, corticosteroid, stress and inflammation, your body's natural cortisone, prednisone, etc. The problem is that is naturally anti-inflammatory. Acutely, it will help with inflammation. But when it's chronic, the cortisol itself can be the root cause of its inflammation because it will start to break down tissue. And the more that tissue is broken down, you have more inflammation that results from that. So acutely, cortisol is anti-inflammatory. Chronically, it can actually create more inflammation. It can weaken body structure and body tissue, now putting the body in a weaker place to defend itself, now predisposing more pain in that area in the future. Well, we know that with cortisone injections. If you ever got a cortisone injection, it may work once or twice. The doctor's like, hey, we got to be careful because now it's going to start destroying the joint. Well, you could still have a similar level of destruction, not the same level, right? Because we're not targeting it like an injection can, but you can create similar weakness in areas with hyperadrenal chronic cortisol issues.
Wow, that's you literally segued exactly into what I wanted you to talk about next. Was before we get into the functional strategies, to chat about the conventional strategies first. So can you tell us a little more about that? So people come in, they say, hey, my knee hurts, they get the cortisone injection. You're saying you have a limited time frame where that's going to work. So what happens after, I don't know, 2 or 3 knee injections? Then what?
Well, they're going to just tell you they can't do it, right? They're going to tell you they just can't do it anymore. And they would probably move you to more of a NSAID, non-steroidal anti-inflammatory that doesn't have all the cortisol effects. They may give you, they may even go to an opiate where it's blocking the perception of pain in the brain. So one, they'll go to a medication that's reducing the inflammation without the steroids, right? Number two, they're more than likely going to go to something that's going to decrease the perception of pain in the brain. But opiates have their own list of side effects and they're very addicting. So that's the last thing you ever want to go to. You're much better off going to see first line is a chiropractor, right? Which I have a doctorate in chiropractic medicine. So chiropractic's really powerful because it helps move the joints. Good chiropractors also look at the joint above and below because a lot of times when there's inflammation in a joint, if it's not acute from like a fall or like sleeping on your neck bed, a lot of times there's instability above or below the joint. So you always want to look above and below. And then you also want to look at the soft tissue because soft tissue is your natural shock absorber and you want pliability in your tissues, right? There's issues in the tissues where that soft tissue is not stabilizing you. It's like relying on beef jerky for your shocks versus a nice, soft, lush, plush pillow, right? So the more pliability there is, the better absorption. The less pliability, think beef jerky, it tears. It's not going to absorb and cushion.
Well, and you're not going to have that conversation with this person. They're probably just going to refer you over to a surgeon, right? For a potential knee replacement if it gets to that level of severity.
Yeah. Once you get to that level, the chance of being on opiates and more of those medications is really bad, right? Once you start getting on a lot of NSAIDs, Tylenol, those things are going to deplete glutathione as well. I mean, the peer-reviewed literature is quite clear that you're going to have a massive depletion of glutathione. You're going to increase tearing up your gut lining, more liver stress. And then now you increase other metabolic issues, right? And then at the same time, once you get a surgery, you may not be fixing the root cause, and that may create more need for opiates in the future. So you're much better off seeing a high quality chiropractor that's going to be looking above and below holistically, that will also be looking at the soft tissue integrity. If you're going to see a medical doctor, you always want to see a chiropractor first, but then maybe seeing someone that does PRP injections or stem cell injections, maybe a better way to help accelerate the regeneration of that tissue is very powerful. My friend and colleague, Garrett Salpeter over at NewFit in Austin, he has a great technology called the Newbie, and we're having him on the show in the next 4 weeks. We'll put his info and link below. He has a great technology that uses bioelectricity. It's in a harmonious frequency that helps stimulate blood flow, increase oxygenicity, and helps improve muscle stabilization. And that technology is phenomenal because it doesn't have really any side effects outside of maybe a little bit of soreness. And it's working partly at fixing the root issue. And when you combine it with adjusting in soft tissue support and maybe even stem cells for more severe damage, it's really a winning team.
Yeah, that was what I was going to ask you, because I thought you did a podcast on either prolotherapy or stem cells. So wouldn't that be a next potential option if you're running out of options with your, let's say your cortisone shots don't work anymore? You're saying prolotherapy and or stem cell would be possibly the
So
next.
first line of therapy is number one is a chiropractor and good high quality soft tissue, and soft tissue being in the myofascial release ART. And then supplementing that, which is still on the same foundational level for me, is using the newbie or some kind of bioelectric device that harmonizes with the body that will help accelerate healing. That's foundational. And then depending on what kind of damage is there, then we may add in stem cell or PRP injections or prolotherapy. I think stem cells is probably going to be the best just because it's using your own tissue, where PRP is going to be using platelet-rich plasma, which may be from your own tissue as well, still better. And then the prolotherapy will be using like a D-mannose or like some kind of a sugar solution to stimulate internal healing. So I like stem cells first, which it may come from, a lot of times they'll get it from umbilical cord, or they'll get it from your own fat tissue, or they'll spin out the fat as well and get the PRP from that as well, or they'll pull it from a joint, right? So it depends. There's different ways to do it. And then even beyond that are going to be, we go even below that for foundation is going to be diet, right? Paleo template, maybe an autoimmune template, and then various different supplements, which we can go into in a minute on that side. Did that kind of lay out that treatment hierarchy?
I believe so. Yeah. Let's get into, before we go into supplements, let's go into just a couple of things we're going to be looking at from a functional medicine testing perspective, things that we may see red flags on that would help clue us in. So specifically, I'm thinking about just infections as a whole. We talked about mycoplasma already. So we're probably going to be looking at possibly virus, bacteria, parasites, candida. I mean, there's a lot of different gut infections, and then systemic infections that could be huge. I mentioned Lyme briefly. So if you have migrating joint pain specifically, that may clue us into something like Borrelia. So you may need to get a full, Lyme tick-borne co-infection panel, a viral panel, a bacteria, parasitic panel, and then gut infections can play a role too.
So in general, anytime there's some type of gut inflammation, that can easily emanate, especially if the history is a chronic history for pain. The gut always has to be ruled out. Okay. The adrenals have to be ruled out. Another reason why the gut could be a problem is, guess where all the nutrients to build back up your tissue and cartilage comes from, right? It all comes from your gut, all of the amino acids, right? The collagen amino acids, the proline, the hydroxyproline, the glycine, all of these expensive tissues that are avascular, like connective tissue like cartilage, tendons, ligaments. These tissues are avascular. I mean, they don't have a great deal of blood supply. That's why using some of these technologies may accelerate the healing when there's damage done to avascular tissues. Tissues like muscles, they're more vascular. They heal faster. So like your issue with your neck is probably a muscular issue. It'll heal a lot faster than if you had a whiplash injury from a car accident. That may take 6 to 8 weeks. So that's why it's important to understand the history of it, because that can guide us into how long things may take to heal. But when it's chronic like that, all those nutrients from the gut have to get absorbed there. And of course, things like omega-3 fatty acids may be used supplementally. We may use things like systemic enzymes, lumbrokinase, serrapeptidase, which will be taken away from food to help digest inflammatory mediators and cytokines. We may also use things like liposomal curcumin. I have a product called Curcumin Supreme that's liposomal. Why is that better? Because about 15% of curcumin is absorbed in a powder form. So when you liposomal it, you get about a 6 to 8 time increase in absorption. So, just because you take it, you have to absorb it, assimilate it, and utilize it. So a liposome can be very helpful for that. Other things could be boswellia / frankincense, topical or internal CBD can also be used. And I would even say white willow bark, which is the main constituent of aspirin, which is acetoacylic acid, acetylsalicylic acid. That's basically your aspirin, and that's going to be your white willow bark. And so we can do that at high doses too. Do you want to add some more things to the list?
I do. So California poppy could be great. Like, let's say you don't want to go on an opiate. California poppy could be something. I mean, it technically is in the they can make opium from California poppy, right? So you could do tinctured versions of that. And
Correct.
I'm a big fan of trying to implement some of the herbal muscle relaxers too. So like valerian root could be used,
Yep.
chamomile could be used, passion flower could be great, lemon balm. So magnesium, extra magnesium could be helpful. So I think integrating some of the stuff that Justin's mentioned with the systemic enzymes and the anti-inflammatories like your boswellia, maybe some ginger thrown in too, and then you combine it with some herbal relaxers like your passion flower, your valerian, motherwort may be helpful, although that's typically more nervous system related. Topical magnesium, like we've played with some magnesium creams and magnesium gels and stuff before. Float tanks like Epsom salt baths on steroids, those are flotation tanks. Those can be huge.
100%. Those
I
are
mean,
great.
it is a hell of a protocol. And then at the same time, of course, we're running the functional medicine testing because, like Justin mentioned, okay, let's say you're doing like, oh, I found this fancy organic bone broth protein powder. It's like, okay, great. But you've got H. pylori, you've got no stomach acid to even digest and do anything with those amino acids you're getting. So we can give you these band-aids we just mentioned, but then it's always working backwards to fix what led to the digestive disruption,
100%.
which led to the inflammation from the malabsorption in the first place.
100%. I 100% agree with that. And you mentioned magnesium, you mentioned kind of natural muscle relaxers that can be helpful. And then of course, there's other topical things we can incorporate like cold laser therapy. There's certain frequencies that can be very helpful for that. And also red light. I have a Juve light, right? Juve is awesome because it has the red light therapy, which is more superficial, but it also has the near infrared setting on there, which will allow deeper penetration for inflammation reduction. And you can just, stand 4 to 6 minutes away and get about 4 to 6 inches away and get about 10 to 15 minutes of treatment on that. And that's going to be phenomenal to help that inflammation. So the Juve is amazing. And you can go to justinhealth.com/Juve and get access to that.
Cool.
I think it's justinhealth.com. So I think it's a red light. We'll put the link below. So if you guys want to look for some of the things we're talking about, you'll have access to it below.
Okay. Yeah. I went into the sauna the other day. I've got the near infrared bulbs inside of my sauna as well. So I kind of turned around and let those lights hit my neck and hit my back. And I can't say it was a magic cure, right? But it definitely helped. And then, I did do a 90-minute massage as well. And that was helpful. But some things they just have to work out of your system. You know what I mean? So in my case, this is more of just a weird one-off situation, but in a more chronic situation, yeah, I think all these other tools would be helpful. And then, of course, you always have to have a plan of what's next, meaning, okay, you take the magnesium, but then what? Because that's not just the only thing dysfunctioning. There's probably a whole systems approach that you need to look at. And that's what we love doing. We love finding and getting all the puzzle pieces laid out in front of you. So if you're somebody who is struggling, you've been through the conventional orthopedic route, you've done the cortisone shots, maybe it's the migrating pain. You haven't thought about how your pain starts in the morning in your left elbow, and by the end of the day, it's in your right knee. I mean, these are things you need to look at. So if you need help clinically, that's what Justin and I are here for. And we can achieve all of this virtually. There's no need for an office visit with the type of labs we're talking about. For example, that mycoplasma thing that we did on my wife, Justin wrote up the requisition form, sent it to my email. I print it out. We go to the lab, get the blood draw. You go home, you get the answers, you get the protocol done over the phone. It's easy. So there's really no limit to what we can do. We live in a great time right now with virtual practices being able to help so many people in such a deep way.
100%, man. I totally agree. And we're on the same page. And there's a lot of options out there today, which is amazing. It's not just go to your doctor, take these medications. They may have side effects and they may also ignore the root cause. Now we actually have information out there that really gives people a chance to choose, what's the best option for them. And also they are educated behind it. They're making a more informed decision, which is great.
Yep. So if you want to reach out clinically, and if you had any other notes, please give them to us. But if you want to reach out clinically, you could reach Justin at justinhealth.com. That's Dr. J, justinhealth.com. If you want to reach out to me, the website is evanbrand.com. And either way, we don't care who you pick. We just care that you get better. So we hope this has been helpful. And then if you have comments, if you're watching on Justin's YouTube channel, please put comments, questions. Let us know what you want us to cover because we're always open and willing to change the game plan based on what you care about.
Exactly. And then access the red light, which I've been using for the last month or two. It's working amazing. justinhealth.com/red-light. We'll put the links below all the products that we're recommending. That way you guys aren't having to dig around. These are things that we all personally use for ourselves and our family. So we don't want to recommend anything that we don't personally back. So that gets really important. And then Evan, you can reach out to Evan Brand, evanbrand.com as well. Consultation worldwide. Hope you guys are enjoying the content. If you are, sharing is caring. Give it a blast, give it a thumbs up. Head over to iTunes as well to help us out. evanbrand.com/iTunes, justinhealth.com/iTunes. That's the little short link to get there. We appreciate your reviews and your feedback. Hey, Evan, it was phenomenal chatting, man. You have an awesome day.
You take care.
Take care. Bye now.
Bye-bye.